Mr. Chairman, we have Dr. Tom Borelli from the National Center for Public Health Policy Research. He would like to discuss the Johnson & Johnson role on the Obama policy.
Good morning, Mr. Chairman and shareholders. As introduced, my name is Dr. Tom Borelli with the National Center for Public Policy Research. And part of what our role is, we hold CEOs accountable not only for their financial risk and exposure, but also for their public policy. Now, as we all know, Obamacare passed last year despite the overwhelming number of Americans that were opposed to it, and I add multi-million dollars in cuts in Medicare payments for the elderly as part of the plan. My specific question is, what role did Johnson & Johnson play in passing this legislation? How much did Johnson & Johnson contribute to the $150 million ad campaign that the pharmaceutical industry broadcasted nationwide in conjunction with union labor activists? And finally, what do you perceive to be the reputational damage to your company for being a big backer of a policy of which the vast number of American people are opposed to, including the millions of Tea Party patriots who are trying to stop Obamacare? We're trying to hold you accountable. Before we do, we'd like to know some specifics with respect to how much money you contributed so we can hold you accountable. Thank you, sir.
Thank you for your comments. The first thing is we are part of an organization called PhRMA in Washington, and it was PhRMA that was running campaigns. We pay our dues to PhRMA, and we contribute as all pharmaceutical companies do. As far as supporting the programs of Obamacare, as you refer to it, we feel, and we've had a program for years which has said basically our promise for health care, where we support coverage for people, and we think people should have access to affordable health care. We feel that is very important. We also feel that there are things like comparative effectiveness that are very important. There are many things that need to be utilized appropriately that would be included within this bill that would allow people to have access to health care. So there are parts that we support, there are parts that would not be supported, but we feel that there are things that would be very good for the people of America that are in Obamacare, and then there are other things that have to be addressed. As far as how much money we supported, somebody could get that to you, but it's basically through our contributions, through our involvement in PhRMA and the dues that we pay to PhRMA.
It might have been extra dues to PhRMA. And if you could just address...
Yes, there were. I don't want to deny that.
Okay.
There were extra dues. There was an assessment of all companies, but it would have been exactly what would have been assessed to companies. So we would have put in what exactly our assessment would have been.
And the reputational damage for supporting Obamacare?
I don't think that there is any reputational damage. I think that there is support for people to have accessible, affordable health care.
Everybody wants health care. That's not the point.
Excuse me. You asked for my comments. I agree. Everybody wants health care. Everybody wants people to be taken care of. We want accessible, affordable health care. There are things in the bill that we would not support. There are things that are very important. We would like to see people treated appropriately and taken care of, and we think that is very important. Now, this will be continued to be discussed and worked through, and there will be changes as this bill moves on.
It may very well be unconstitutional because there's 20 states that are trying to stop it.
Okay. That will be determined. I appreciate your comments. Thank you very much. Number 4.
Mr. Wells.